Hey everybody, how we doing? All right, so last week we went over the upper appendicular skeleton. So this week we're going to go over the lower appendicular skeleton. And remember, this is your legs and everything that your legs are attached to, which includes your pelvic girdle. So that's also your hip bones are part of your lower appendicular skeleton. All right, so make sure you have your app open, your Essential Skeleton 4 app open, because it's very helpful, and make sure you have your list out. And again, we are not covering everything that's on the list. There's a modified version of this list on our Canvas page, so make sure you have that open. All right, so we're going to jump right into this by looking over the os coxa. So this is number 6 in your list. And your os coxa is your hip bones, all right? So we don't use the term hip bone in this class. That is layman's terms. We're going to be professionals, so we're going to say os coxa. Now, when you click on your os coxa, or you try to click on your os coxa, you'll notice you can't highlight the whole thing. All right, you're going to click on different parts of the os coxa, but not the whole thing. And there's a reason for that. The reason is because your os coxa is actually 3 different bones that have fused together. So you do need to know and identify these 3 different bones because they're going to help guide you to a lot of the structures that are on the os coxa. Okay, so here we have a disarticulated os coxa, and again, we have to figure out where our 3 bones are. And I will show you a trick in order to figure it out. So this is how the bone should be sitting in your body. The crest should be more superior, all right, because this is the top of your hip. And then this giant foramen should be more towards the inferior. And this giant crater right here should be lateral because that's actually what's going to make your hip joint. Your femur is going to attach into there to make that joint. Okay, so a trick to figure out the 3 bones because it's hard to see where they are. Take your fingers like they're scissors and cut that foramen in half, that giant foramen at the bottom. If you do it right, your finger should fit into a notch that's in this crater right here. Again, I'm not using the terms yet because I just want to make sure everybody can identify the bones first before we jump into the terms. So once you have your fingers like scissors and cut this in half, you've already divided 2 of the bones. You have a bone right here and a bone right here. Now the 3rd bone you could find is if you take another finger and make a T with one of the fingers that you use to create scissors with. All right, so that's the dividing mark of these 3 bones. All right, so we have this one up here. All right, we have one right here, and then we have one right here. So let's talk about the names of these. So the top one is called your ilium. All right, this is all part of your ilium up here. Okay, then we come down here. This one that has a lot of rough patches on it is called your ischium. Another way you can see that's the ischium is because the ischium has a spine on it. So again, this is the front side, so I'm just making the T again. You can see the spine right here that the ischium has. All right, you don't see this on this 3rd bone. So again, ilium, ischium, and then this last one right here is called your pubis. All right, your pubis on one os coxa and your pubis of another os coxa come together to make your pubic region. So this should be facing more anterior. Okay, so next you need to figure out if you have a right or left os coxa just by looking at it. All right, so a couple things to keep in mind. I already mentioned these, but this crest, if it's facing superior, this crater that's making the hip joint should be facing lateral. The last piece of information you should look for is this spine that's on the ischium, because this needs to face posterior. So this needs to point backwards. All right, so this way is posterior, this way is superior, and this crater is lateral. So let's turn this way. So the spine is posterior, the crest is superior, and the crater is lateral. Do I have a right or left hip here? Well, this would be a left hip. All right, there's no other possibility. So if we bring it to this skeleton here, it would be this hip that is highlighted right there. All right, so it would be this hip. All right, so just keep that in mind. Those are 3 good landmarks to use to figure out if you have a right or left os coxa. Okay, so now that we know the names of the 3 bones that make up the os coxa, we can start learning the structures of the os coxa. And they're all going to have one of those bones in the name. All right, so it kind of leads you to where they are. So the first thing on your list that you'll have to identify is called your iliac crest. Well, iliac is referring to ilium. And if you remember, your ilium was the one that's up here. Your iliac crest is that crest that makes up the top of your hip. That is called your iliac crest. All right, and this is what your book used as an example for a crest, a narrow ridge-like structure. All right, after that, then we have iliac fossa that you need to be able to identify. And we actually have two iliac fossa. We have one right here that takes up the main body of the ilium and one back here. Now, if you remember what a fossa is, it's a basin-like depression, meaning a drained lake, pretty much. So if you flip this upwards, it looks like you could hold some water right here. Like somebody had a lake that they drained, and that's all that's left is the fossa. Same thing on the backside. So if you see a sticker right here and ask for that structure, or right here, chances are they're asking for the iliac fossa. All right, so that's all the structures you need to know for the ilium. Now we're going to go down to the pubis and ischium. Again, I need to know which one's which, so I'm going to use my handy scissor technique, separate everything out. All right, so here's your pubis, here's your ischium. All right, so let's go ahead and look at the ischium first. First one you should identify is this spine that we used to see if it was a right or left os coxa. This is called your ischial spine. It is a spine that is sticking out posteriorly of the ischium. So ischial spine. And then around the ischial spine, you have two notches. You have a notch right here, indentation, and then you have a notch right here, an indentation. All right, these are called your sciatic notches because it's where your sciatic nerve runs through. But there's two of them, and one's bigger than the other. So you might be able to guess what each one is called. All right, the bigger one is going to be called the greater sciatic notch, while the smaller one is going to be called the lesser sciatic notch. So greater sciatic notch and lesser sciatic notch. And then I'm going to turn this around so you see the full ischium back here. And you notice there's a very large or a very prominent bump with a lot of roughness to it. All right, this is where a lot of your leg muscles are going to attach to. All right, so this is on the back side of the ischium, so this is more posterior. And this is called your ischial tuberosity. All right, remember the definition for tuberosity, round and rough. Well, that is definitely round and rough. And again, a lot of the bone or a lot of the muscles of your legs are going to attach to this, and that's why it's rough. Okay, so a couple more structures that you need to know. So now we can talk about this actual foramen that we used at the beginning. This is called your obturator foramen. Obturate in Latin means closed, and it got its name because if you took this out of a fresh corpse, you would see a bunch of connective tissue here that is tightly bound across this foramen. All right, very tight, almost like a drum. So that is where the name's coming from, because it's closed off by connective tissue in the body. So this is called your obturator foramen. All right, and the last few structures are in this crater. All right, and remember, this crater is kind of right in the middle of the three bones. All right, so you have a little bit of that crater on each one of these bones. All right, the crater itself is called your acetabulum. And this is the socket that makes up the ball and socket that is your hip. All right, the ball is going to be on the femur that fits into here, and here's your socket. All right, so this is called your acetabulum. But if you look inside your acetabulum, you'll notice that there's a very smooth surface going along the walls of the acetabulum. Not so much in the middle, but definitely along the walls here. All right, we have a term for this. We call this the lunate surface. And the reason it's called a lunate surface is because it almost makes a full moon. All right, almost a full moon. It would be a full moon if it wasn't for this notch right here, but you don't need to know that structure. So this is your lunate surface right here. So for a quiz, if there is a sticker right in the middle, the question's asking for the acetabulum itself, this whole crater, if it's right in the middle. However, if a sticker's off to the side along the walls of the acetabulum, it's looking for the lunate surface. It's a nice smooth surface, so it's reducing friction with this joint. Okay, so the last structure that you need to identify is a joint that's between the os coxa and the sacrum. So that's actually how your hip bones are connecting to your axial skeletons with the sacrum. All right, so let me just turn down the exposure here a little bit so you can see it better. All right, so this is the joint that's being made. Here's your os coxa, and here's your sacrum that we covered a couple weeks ago with the axial skeleton. So the name of this joint is really easy because it's named after the bones that are making this joint. This is your sacrum. This is your ilium. Remember, this is the ilium bone. That's part of the os coxa. This is called your sacroiliac joint, the joint that's made between the sacrum and the ilium. All right, so that's all the structures you need to know for the os coxa. Again, it's important to understand how it fits into the body and being able to tell right and left with it. And you need to be able to separate out those 3 bones in order to name any of these structures. Okay, so the next bone we're going to go over is your femur. Your femur is the largest bone that you have in your body. And your femur is very innervated, meaning it has a lot of nerves that run through it. So it's extremely painful if you ever break your femur. All right, so here's a femur, a real one. All right, so this is not a model, this is a real femur. So there is a lot of different structures that are going on here, but before we get into all that, we need to be able to determine right and left with this. All right, so remember, we have that acetabulum that's on our os coxa that's making up the socket of the hip joint. So the femur is going to hold the ball to the ball and socket hip joint. Do you see a ball anywhere on here that might be used to make the ball and socket hip joint? Well, yeah, it's right here. All right, so this is the head of the femur, and this is going to be facing more proximal, closer to the body, because it needs to fit into that acetabulum in order to make that ball and socket hip joint in order for your hip to work. All right, so we already started with the structures of this. So this is the head. All right, but we still don't know if it's right or left, because even though we know this is proximal and this should be facing medial in order to fit into that acetabulum, it could be here on this skeleton, or it could be here on the skeleton. All right, so we still need one more piece of information to know which one's which, because one of these is wrong and one of these is correct. All right, so the next piece of information you need to know is if you come all the way down here, you're going to notice more structures at this end. This is where your knee starts. You have this smooth surface right here, and then you have on the backside a big fossa. All right, so similar to the humerus that we saw last week, the fossa of the femur should be facing posterior. All right, so I'm not going to say the name of this fossa just yet. I just really want to get the right and left down first before we jump into any of these structures. But again, this fossa needs to face posterior. So I'm going to turn this around so it's facing towards the back of the person. So now we know if it's a right or left. And you can see that this is a right femur. It fits on the right side of the body. Because if we had it on the left side, this fossa is now anterior. That doesn't work. We need to turn this around so this is facing posterior and making sure this is proximal and towards the medial line. And then we have the right femur. Okay, so knowing that, now we can jump into all of these different structures that are on this. I'm going to jump around the list a little bit because I like going from top to bottom. It just makes more sense that way. Okay, so we already covered this structure. This is the head of the femur. All right, it looks like a head, and it's surrounded by, or just below it is a narrow neck. All right, so we have a neck and a head. But on this head, we have an extra structure. We have this thing right here. All right, this is called your fovea capitis. All right, so fovea means pit in Latin. And you can see that that's a pit. All right, looks like a little pit in there. All right, and capitis is referring to where it's found. Cap, again, means head in Latin. Well, this pit is found on the head of the femur. So fovea capitis, pit of the head. All right, so there's that structure. Then when we come past the neck, you're going to see 2 more structures. You're going to see this one right here and this one right here. This is the anterior side, so I'm going to flip around to the posterior side so you can see them here and here as well. All right, this looks very similar to what we saw on the humerus. However, on the humerus we had tubercles. Here we do not have tubercles. Okay, so these are very oddly shaped. They don't really fit that definition of a tubercle or a tuberosity for that matter. So we have an extra name for these. All right, these are called trochanters. You don't find trochanters on any other bone, only on the femur. All right, but again, just like we saw in the humerus with the tubercles, with the trochanters of the femur, we have a greater and lesser. So can you tell the greater from lesser trochanter? Well, hopefully by now you can. You know the greater is the larger one, which is this, versus the lesser one, which is this little thing right here. All right, so greater trochanter, lesser trochanter. And then in between these two trochanters on the posterior side, remember I'm on the posterior, you will see this crest right here, all right, this ridge that is sticking out between the trochanter and trochanter. All right, looking at your list, it's easy to remember what this crest is called. All right, everything you need to know is right there in the name. It's called your intertrochanteric crest. And again, that's not really that fancy if you break down the word. Inter is just saying it's between something, right? So inter means between. Trochanteric is saying it's between the trochanters. So intertrochanteric means between these 2 trochanters, there's this thing. And what is it? Well, it's a crest. So intertrochanteric crest. And we're done there. Okay, so the next structures, you got to come all the way down to the distal part of the bone. Okay, so down here we have this round structure sticking out and this round structure sticking out. And if you notice, they're nice and smooth. All right, if you remember from the bone definitions, smooth and a process that is smooth is called what? It is a condyle. Remember, condyles are used to connect bones together. All right, so these condyles will meet other condyles of another bone to create a joint. That is why they're smooth, to reduce the friction in this joint. However, there's two of them, so we need to be able to identify one from another. And we do that by calling one of them lateral and one of them medial. So just looking at this, can you tell which one's the medial condyle versus which one is the lateral condyle? Do you think this one is the medial or the lateral? Well, this one's going to be the medial. And how did I know that? Because if I come all the way back up here, it's on the same side as the head, which is facing medial because it needs to go into that acetabulum, right? So this is the medial side, meaning this is the medial side. This is your medial condyle, while this is your lateral condyle. And remember, whenever we have condyles, we also have these structures on the side that are nice and rough. So we have this process and this process on the sides that are rough. These are going to be used to attach ligaments that hold this knee joint together. All right, and they're on the sides of the condyles. These are called your epicondyles. So you have two epicondyles, one here, one here. And just like the condyles, we have a lateral and medial. So which one's which? Well, this is going to be the medial. How did I know? Because their head's on that side, so medial epicondyle. And then we also have a lateral epicondyle. Now remember, these two structures, even though they look like they're the same, they're not. You have a smooth part and you have a rough part because they have different functions. Bone-to-bone connection, ligament attachment. Okay, so a couple more structures you need to know. So come down here to these condyles on the anterior surface. Remember, this is the anterior, this is the posterior. So on the anterior, you'll see this nice smooth spot between the condyles. This is going to house that little bone that makes up your kneecap called your patella. We haven't looked at the patella yet, but we're going to. So this is where your patella is going to touch your femur. All right, so you can kind of get a hint to what this is going to be called. This is called your patellar groove. It's a groove, a little carve out, to hold your patella. And the reason it's smooth right there is because your patella is a bone and you don't want too much friction between your bones. All right, so that's on the anterior side. Now, if we go to the posterior side, flip this over, you're going to see this fossa that we used to figure out what was the posterior side. Now, the name of this fossa is actually pretty easy. Look where it's located. It's between these two things. It's between the condyles. So can you guess the name of this fossa? Between is what? Inter, right? Condyle, meaning condylar, and then it's a fossa. So we have this intercondylar fossa, which is a fossa that's between the condyles. Easy, done. All right, so right above this intercondylar fossa, you're going to see this flat spot that makes up the back of the leg. All right, this is named after the region that it's found in. All right, do you remember what the back of the knee was called from the regions? It was your popliteal region. Well, this surface right here is called your popliteal surface. It's a nice flat spot that's on the posterior side of your femur. All right, so your popliteal surface is right above, or superior, or I should say proximal to your intercondylar fossa, which is this fossa that's between the condyles. Okay, so that is all the structures you need to know for the femur. Again, just keep track of right and left and knowing the names of these structures. Okay, so next we're going to go over the two bones that make up your lower leg. So these are going to attach to the femur to make up your knee joint, and you have two of them just like we saw in the forearm. All right, so one is called your tibia and one's called your fibula. All right, just be careful of the spelling there. All right, there is an L in fibula, but there's no L in tibia. I see a lot of students get those two confused. And here's your two. All right, so you need to be able to tell one from another. All right, this one's more of a baton-looking bone. All right, while this one is not so baton-looking. So how I remember this is that the tibia takes the shape of a capital T. Does one of these look like a capital T to you? Well, yeah, this one does, right? Here's the capital T right there. So this is your tibia. Well, this is your fibula right there. All right, I'm going to start with the tibia because there's more going on there and there's more structures you need to know than there is with the fibula. All right, so first things first, we got to figure out if you have right or left tibia. Well, looking at the tibia, you'll see that the big T part should be facing proximal. This is what's going to attach to the femur in order to make your knee joint. So if I grab my femur, remember you have your two condyles of the femur, and I grab my tibia, that's where the two attach to make up the knee joint. All right, so knowing that the top part of the T is the proximal side is going to help you out a lot. All right, so, but still, we need to know, is it this way, or is it this way, or is it this way, or is it this way? All right, so we have a lot of options, so we need more information in order to figure out right and left. The best thing you could do is go all the way down to the bottom of the tibia and see this process that's sticking out right there, okay, at the bottom of the tibia. This is that little bump that is on the inside of your ankle. This is called your malleolus. It's similar to the styloid process that we saw in the ulna, but here we call it a malleolus. So that's your malleolus. So if you follow your leg all the way down and go to the medial side of your leg or the medial side of your ankle and feel that bump that's down there, that is your malleolus that you're touching. So you know this should be facing medial towards the midline. All right? Well, if this is towards the midline, we're almost there. So we know this is proximal, this is medial, so it could be here, which hits those 2 points, or it could be over here like this, which hits those 2 points. So you do need to know one more piece of information in order to figure this out. The last thing you should identify is this bump and this crest right here. So this bump is called your tibial tuberosity, and it's on the anterior side of your leg, so towards the front of the leg. And this is where some of the ligaments that hold your knee together are going to attach. And this crest right here is actually what makes up your shin. Now you imagine how much it hurts when you hit your shin, all right? You're hitting right here. So this is called your tibial crest right here. It's a narrow ridge, tibial crest. All right, so both of these should be anterior. Now we can figure out if we have right or left. All right, so this is proximal. This needs to be medial towards the midline, and this needs to be forward. With all those things in mind, we see that this is a right tibia. All right, medial towards the midline, anterior, and proximal. Okay, so there's a couple more structures on the tibia that you do need to know. Coming back up here to the top where the T is, you could see that we have two smooth surfaces right here. This is what's going to match the femur in order to make the knee joint. All right, these are also called condyles. And you have a medial and a lateral condyle. So how do you know which one's which? Well, the best way to do it is to come back down here and see where the malleolus is. Remember, the malleolus is medial on the tibia. Coming back up here, you can see that this is the medial condyle, this smooth projection, while this one is your lateral condyle going to the outside of the body. And then between these condyles, we have this eminence. All right, we haven't used the word eminence yet, and this is the only time we're really going to use it, but an eminence is really something that sticks out and just doesn't really fit into the other definitions. So this is your eminence, but there's a special name for this particular eminence. It's called your intercondylar eminence. Now, why is it called that? Well, because it's between the two condyles. So we're seeing a pattern here with this naming system, intercondylar eminence. All right, and then we have our tibial tuberosity, and then our tibial crest, and our malleolus, and that's all the structures that you need to know for the tibia. So now we're going to move on to the fibula. Now with the fibula, all you really need to do is be able to identify a fibula and know where it's located in the body. Now you have a tibia and you have a fibula. Which one of these bones is going to be medial and which one of these bones is going to be lateral? So you may have figured this out already. All right, knowing that the inside of your ankle is this bump, you should be able to determine that the tibia is more medial while the fibula is more lateral. All right, again, you don't need to know any of the structures on the fibula, just that it's lateral. And the last thing I want to point out is the difference between the fibula, all right, and the radius of your forearm. I see a lot of students get these two confused. Look at them, they're different. All right, so they do look pretty similar. They're nice and thin going all the way through. But with your radius, you have a very obvious head that has that cup in the center. All right, there's the head of the radius, if you remember from last week. You don't really have that with the fibula. All right, nothing that's a defined head like that. Okay, also with the radius, it comes out a little bit wider at the bottom here. Well, with the fibula, it's pretty much uniform all the way through. All right, it's like a very long baton. Each side's a little different, but it looks different from the radius if you just take the time to look at the differences. Okay, so the next bone we're going to look at is that little tiny bone that floats in front of your femur and tibia. All right, this is called your kneecap, which is the layman's, but in this class we call it a patella. Patella is the official name for this bone. So it's a little bone that sits in front of the knee, all right, which makes up your kneecap. Now, there's not much going on with this, but you do need to be able to determine some of these structures. All right, if you notice, there's two different sides to this. There's a rough side and then there's a smooth side. The smooth side is made out of two facets, all right, while the other side is rough. So one of these sides are called the anterior surface, while the other side is called the posterior surface. Knowing that sits in front of the femur, can you figure out which side is the posterior? Is it going to be the rough side, or is it going to be the smooth side with the two facets? Well, it's going to be the smooth side, because remember, these smooth sides need to touch the femur. All right, since they're facing posterior, they need to touch the femur, and you want them to be smooth to reduce that friction. All right, so this is your posterior surface with the two facets. This is your anterior surface that's rough and a little bit more rounded. All right, two more things in case you need to know right and left for this one. One, you notice how it comes to a point. This is called your patellar apex. This should always face downwards. All right, so knowing that this faces downwards helps you figure out if you have a right or left. So we're still trying to figure it out. Is it over here or is it over here? Well, the last thing you need to look at is to go back to the posterior side and look at your two facets. Notice you have a bigger facet and then you have a smaller facet. If you could just write down or just make a little asterisk next to this, the bigger facet, you don't need to know the name of it, but the bigger facet is always on the lateral side. If the bigger facet's on the lateral side, you'll be able to figure out if you have a right or left patella. So let's see. We have this facet. It needs to be on the lateral side, meaning going to the outsides of the body. This needs to be facing posterior, and this needs to be inferior. All right. So does that work here? No, because that bigger facet's now medial. Well, what about on this leg? Yes, now this bigger facet's on the lateral side, the apex is inferior, and the facets themselves, the posterior surface, is posterior. All right, so that's everything you need to know for the patella. And the last thing we need to go through is the human foot. All right, there's a lot of similarities here with the hand that we covered last week. Okay, so first things first, we got to figure out if we have a right or left foot. Easiest way to do it is just go to the big toe. And where's the big toe in the standard anatomical position? Well, the big toe is medial. This is different than the hand because your thumb and your hand is actually lateral in standard anatomical position, but the big toe is medial. So you can see that here. Big toe, medial. All right, so we're going to go through all of the bones of the foot. And luckily, they're not that complicated. So the first thing that we're going to identify is this group of bones right here that technically is your ankle. All right, a lot of people think the little things, the little bones or the little bumps sticking out the sides of the bottom part of your leg is your ankle, but that's not true. Your ankle is actually this group of bones that's found in the top of your foot. And just like we saw in the hands where the wrist bones are called your carpals, here the ankle bones are going to be called your tarsals. So just make sure you don't get those two confused. We have tarsals here and carpals in your hand. Okay, so there's a bunch of different tarsals that you need to identify. You have this one right here that's going to attach to the fibula tibia to make up your ankle joint. You have this one back here that's going to make up your heel. You have this one right here, and then you have three small ones that are on top of this one right here, and then you have this squarish one out to the side here. All right, so I'm going to help you out with the names or give you little tricks to remember the names of all these. So this first one here that actually has a little condyle on it to make up the joint that is your ankle. How I remember the name of this one. So if you think about birds of prey, so eagles, hawks, stuff like that, birds of prey, how do they hunt? What do they use? Well, they use something called a talon, right? So birds of prey have something called a talon. They go down, they swoop things up with their talon, and then fly off with it. Well, they're able to move their talon because of this bone, all right, with this condyle on it. So the name of this bone is talus. All right, so if you remember birds of prey use their talus to swoop down and pick things up with their talons, it's easy to remember the name of that bone. All right, just underneath the talus, we have this large bone that makes up the heel. All right, it's a very big bone. Seeing how big it is, doesn't it look like it could store a lot of calcium? All right, so since it stores a lot of calcium, that's how I remember the name of this bone. This bone is called your calcaneus. Calcium's right there in the name. Stores a lot of calcium, that's your calcaneus. All right, so talus, calcaneus. Then we have 5 more bones of the tarsals. So we have this long one right here that has 3 little ones sitting on top of it. And then we have this square one out here. So I'm going to start with this one right here. So I'm going to actually tell you where the name of this came from. This looks like a little boat that has 3 little sailors in it. So the 3 sailors are sitting in this boat. All right, so the root word here is navi. Just like it's in navy, here's called your navicular. Navy means ocean or sea, right? Or using a boat in the sea. So the boat is called your navicular. Same word as navy. Okay? Then your 3 sailors all have the same name. They're called cuneiforms. All right, so you have 3 cuneiforms. However, you need to be able to identify one from another, and it's more about direction. So this one right here, do you think this is going to be called a medial or lateral cuneiform? Well, this one that's directly under the big toe should be called your medial cuneiform because it's towards the midline. What about this one that's furthest to the side? Should that be medial or lateral? Well, that should be lateral cuneiform because it's furthest to the outside of the body of these 3, right? But then we still have this one in the middle. All right, we do not call it a middle cuneiform. We usually reserve the name middle for things that are going from proximal to distal. Here, since it's between these 3, between medial and lateral, we call this intermediate. This is an intermediate cuneiform. So we have a medial cuneiform, an intermediate cuneiform, and then a lateral cuneiform. All 3 of these are sitting in the boat, which is your navicular. And then your last tarsal is this one out here. It gets its name because it's more of a square shape. All right, if you took it out of the body, you could probably use it as a die, like as in dice. So the square shapes are where the name's coming from. So this is called your cuboid, like a cube. Okay. All right, so cuboid, we have lateral, intermediate, medial cuneiforms. We have your navicular. We have our calcaneus, and then we have our talus right here. So that's all the bones of the tarsals. We got our ankle bones out of the way. That's probably the toughest part of the foot is those bones right there. All right, so just like we saw in the hand, we have these bones that make up the arch of your foot. All right, and they're just beyond the tarsals. So if you know what beyond means in Latin, or what the word for beyond is in Latin, you'll know the name of these. Beyond in Latin is meta, like as in metaphysical or metadata. Well, what do you think these are going to be called since they're beyond the tarsals? Well, these are called your metatarsals, just like we saw in the hand with the metacarpals. And with your metatarsals, you have a numbering system. So do you remember what the first digit is in your hand? Or what rule do we use to figure out what the first digit is? So the first digit is always going to be the biggest digit. And what's our biggest digit in our foot? Well, it's our toe. So here's metatarsal number 1, which makes this metatarsal number 2, number 3, number 4, and number 5. All right, so we're almost done. So we got our metatarsals out of the way. I'm going to cover those up. And now we're left with nothing left but our phalanges. Again, we named these phalanges just like we saw in the hand. There's nothing different there. And just like with the phalanges in the hand, we have 3 phalanges in the toes, and we have 2 phalanges on the big toe. All right, so let's start with the big toe. Since you have only 2, you have this one that's the furthest from the body and this one from the closest to the body. We call this distal phalange number 1, and this is proximal phalange number 1. All right, why do we say number 1? Because it's on the big toe. So let's look at the next toe. We have 3 here. So this little one way out here is called your distal phalange number 2, because we're on the second toe. Then we have this one closest to the body called your proximal phalange number 2. And then we have this one that's in the middle. This is called your middle phalange number 2. Remember, we use the word middle between proximal and distal, while we use the word intermediate between medial lateral. All right, so that is all the bones that we are covering for this class. So just with the foot, be able to name all your different tarsals. That one might take some practice. Remember the numbering system with your metatarsals and your phalanges, and then remember the different bones of the phalanges. Your big toe, as well as your thumb, only have 2, proximal, distal. And then your fingers and toes, the rest of your toes, have 3, distal, middle, proximal. All right, so that's everything that we're going to cover for this week.